As we look at Children's Hospital's future, we needed to combine maternal-child, the delivery of the babies, the mother's prenatal conditions, with the child and infant, and the ongoing care that's ongoing, growth and development. This committee got together and said, well, St. Francis Kuakini voluntarily said, we're not going to do newborn care anymore. We'll give up our nursery. Kapiolani absorbed that. They also said we aren't going to do pediatrics. Children's absorbed that. We then looked in '65 by bringing a consultant in with a medical school developing, with Dr. Windsor Cutting coming in as a dean, of combining our whole institutions, Queens, Kapiolani, Children's. It was ready to go, but at the last minute something came up. Queens rejected it. And with this, we moved ahead with a medical school, and by '67 we're the first children's hospital to develop a professor of chairman of pediatrics with a 2-year medical school that had just started. So we were a little more progressive at the time in thinking, and brought in the clinical science versus the basic science, which is 2-year medical school. In a 4-year, the second 2 years are your clinical science. So the first 2 years are your basic science. And the basic science started soon after '65 with Dr. Cutting. And we moved into having the first chairman. So not only Children's Hospital had the first directive medical education, but the board supported us in moving towards the first chairman of pediatrics in a non-clinical medical school. It's in '72 that the 4-year medical school started, and we were then combining.